Welcome, everyone. I'm Andrew Schulman, the Vice President of Marketing at Populous, and I'm thrilled to be hosting part 2 of our webinar series, Virtual Care in America, the Populous Report, the HCP Perspective. Thank you all for being here. Earlier this year, Populous, along with our partners DHC Group, PM360, and ResearchScape, fielded a triangulated national survey to over 1,250 virtual care users, patients on one side, healthcare providers on the other, and pharma marketers in the middle. All asked about the same thing: how virtual care is functioning inside American healthcare today. Let's get into Virtual Care in America, the Populous Report Part 2, the HCP Perspective. Let me introduce you to the people who are going to break it all down for us today. Christine Franklin is back from DHC Group, today wearing a different hat. DHC's HCP survey and research was conducted in partnership with Sermo, which gave us a direct window into what practicing physicians are saying. Edith Hodkinson, the Chief Strategy Officer at Populous, who commissioned the report and has spent the better part of last year working with me on this, and is expert on clinical workflow media solutions, as well as many other aspects of virtual care and virtual care media. And returning to the conversation is Taylor Wexler, Director of Investments for Point of Care at Havas. She is our truth serum today for the client and pharma marketing side of the HCP engagement equation. Hi.
Hey, Andrew.
Thank you,
guys.
Andrew. Great to be here.
Well, here you go. Well, welcome everyone, and thank you all for coming and watching. All right, let's get into it. 83% of providers use virtual care for at least some patient interactions. 90% are satisfied with it as part of their practice, and more so, it decreases treatment delays. That's not a pilot program. It's not a post-pandemic holdover. That is a clinical tool that the majority of practicing physicians and providers have integrated into how they work. Christine, what does that adoption picture look like inside the practice? And is there a meaningful difference between providers who use it for some interactions versus those who are using it for half or more?
Hi, Andrew. It's nice to see you.
You like I just brought right into the question?
I do.
Had to just
you
dive
rolled right in.
Yeah, it's me.
It's a good question. Andrew, we're really excited to unpack the HCP research from this study and happy to have it in the report. Virtual care is mainstream in America. What the data tells us is that this is, like you said, not a pilot program. 83% of physicians are using it for at least some patient interactions, and they're satisfied with it. I think when you ask yourself why, you need to have the right lens in terms of understanding what's been happening in that ecosystem over the last several years. In our last discussion, we talked about the implication of COVID and how this started. The reality is that physicians are dealing with both the pressures of patient satisfaction and patient experience, as well as in many cases being business owners, or at least beholden to a larger healthcare system and organization. What virtual care is providing them is an opportunity to both increase patient satisfaction, because we saw the data in the last look at this report. Patients want virtual care. Over 50% of them prefer it as an experience medium when possible. So you've got that pressure on physicians to really deliver in terms of a customer experience. But more importantly, we've talked quite a bit as an industry about physician burnout and the reality of the pressure and overwhelm of running a business or having to give up your small practice and integrate into a hospital system. Virtual care is an opportunity now for physicians to speed patient time to care, to more efficiently help patients with refill requests, with chronic care management. And so it's exciting to see this data, but really the reality is this is a new mainstream part of the patient journey. So it's a good start.
It's a great, and I think there's a perception that virtual care is only used for acute care. Right? That's always been the perception, right?
Yeah.
But the data really showed us that it's used in chronic care, it's used for refill management, it's used for interaction with patients. And remember, virtual care, it's not just telehealth.
Right.
It's the patient portal, it's me speaking in any way with my HCP. And I think what we've really seen is that adoption has been demanded by patients, to your point. We saw in the data that the HCPs were lagging behind the patient behavior. Patients want it and they're pushing because they want a world-class experience like they get in retail, like they get in banking, and now they can get it in healthcare. So I think that one of the highlights for me was that virtual care, as you mentioned, is mainstream and it's patients that are demanding it.
Yeah.
That's an excellent point. I think when we spoke last, we were really focused on the patient journey, and I would echo that on this side of the conversation. It's about provider workflow, right? And how does this marry into the work that they're already doing, whether it's helping expedite care or streamline care or offer care in indications that typically wouldn't have had it. I think we really need to think about how we're fitting into that workflow for provider and alleviating some of the stress and pressure they're in.
Yeah, and it's interesting because some of this virtual care experience for a provider takes place on the EHR side of the experience. So the data shows that already 50% of physicians are happy with how well the EHR integrates with virtual care, which is an exciting stat because you're talking about, again, to your point, it's got to work for them. It has to fit into the workflow. We can't give them another obligation that just builds on the burnout, right?
And that leads me into our next question, which is around that clinical integration, right? So great lead up to that. Thanks. You guys give me such the easy runways today. All right, now let's look at those aspects of virtual care and what it's being used for. With 93% of providers using it for follow-up visits, 92% for prescription management and refills, and 72% say it's actively improves their workflow. So it is being integrated. We are hearing the good things. And I know that's a lot of numbers, and I'm going to keep throwing numbers at you, but they actually matter. Beyond the telehealth appointment, they use it for follow-ups, for refills, for chronic care. These are just some of the load-bearing interactions in a provider's week. So Christine, what's the through line in how providers are integrating this? Is there a common logic to which cases go virtual and maybe which stay in person?
Yeah, it's a fair question. And I think to some extent it comes back to Edith's reminder that this is not about acute condition management. It also probably is dictated somewhat by logic. A physician's goal is to have a patient who is healthier, right, than they came in the door. Whether you're talking about chronic care or dealing with an acute condition, what they're recognizing is that virtual care helps them solve that problem. So you do see a skew a little bit in the numbers, right? You mentioned it, 93% are using it for follow-up visits. Logic dictates that that makes sense. In a lot of conditions, you still need a patient in office. And that's why we've had that conversation in our first session. This is not happening in a silo. It's unlikely that a physician in a chronic care condition is seeing a patient purely through telehealth. It's also a reminder, Edith, to your point, that this is not just about telehealth. This is about what's happening inside of a patient portal. And I think you'll see in the report, the data includes that things like text messaging is a part of this virtual care universe. They're also using it for that sort of thing. Or can I remind you to refill your prescription? How are things going? Let's do a quick check-in. And certainly to your point, it's improving their workflow. So it fits into that continuum of their workflow and patient experience where it's meeting gaps.
It's interesting, you see developments in the EHR. Right now we know telehealth is integrated within the EHR. We know that more and more patients are both using patient portals as well as interacting with their HCPs. I have a personal example. So refill reminders, they come from CVS along with a coupon for whatever OTC or CPG product. But for the first time, I started receiving refill reminders from my physician, and I was like, wow, that's different, and that's more important.
Impactful.
And so we're giving physicians ways to interact with patients in a more meaningful way that drives better care, which is, of course, the overall goal of any physician who practices medicine. It's to keep their patients healthy. And so I love the fact that more and more physicians are embracing the technology, embracing the interaction, and in some cases, are they being compensated from healthcare insurance companies for doing that, right?
Yeah.
That's always the
unspoken. It is the business case.
Exactly. Yeah. So I love the way that you brought out the business case for an HCP in improving engagement with patients, but also improving their workflow.
Yeah, absolutely.
I think that's been a key piece to the evolution here, right? What started as a reaction to a very specific and broad-reaching outburst became now this curated thing that is very modular and is growing as each need comes. And I think you all are doing a great job of meeting folks where they are and hearing the feedback from providers of what's working, what's not working, and where can we adapt, and how can we not interrupt. And I think, on my counterpart side at the creative agency, I think they're doing a really good job of understanding those environments and, again, putting messaging together that isn't intrusive and isn't interrupting the train of thought, but is adding to the conversation. I think this has just been such a lovely evolution in lockstep with the changing demand and the changing workflow.
You're so right about that, Taylor, because when you think about a clinical workflow, right, and how sacred that environment is, right? Now you have a physician diagnosing a patient for a very serious, problem or for ongoing chronic care. And we're interrupting that clinical workflow. So that message has to be on point. It has to be super precise, and it has to be delivered in a way that doesn't obstruct the physician's workflow as well. Pharma marketers can use it in a way to remind HCPs that a treatment is available, or that a coupon is available, or that a patient support program is available, so that once they've made the diagnosis and once they've prescribed, they can continue to engage that patient with additional information.
So with 81% of providers attribute improved follow-up completion to virtual care, 82% cite reduced no-shows, and 54% report improved medication adherence. These are measurable clinical improvements, not satisfaction scores. Adherence is better, patients are showing up, follow-through on care plans are increasing. So Taylor, with all these gains, does this factor in when you're considering virtual care media for plans? And have you been seeing this growth pattern in past years from where you sit?
I think it absolutely factors in. I think that, when we think of the who, what, where, when, why as media planners, and who are we trying to connect with, and how are we delivering this message, and why are we doing this? What is the brand ask, right? Where are we in our life cycle? What is the competitive landscape? All of these, scientific, the quantitative and qualitative factors that weigh into building an effective plan. Absolutely, this helps to inform those decisions. I think it's important for us to remember, again, this is another avenue for us to pursue, and for the right indication, for the right brand, and for the right patient population, this could be a tremendous asset for providers to get that kind of reminder going into this, to say, hey, don't forget to talk to your patient about this. And knowing that we are showing up alongside those productive and positively received things. You have that implicit endorsement and also reinforcement of the behavior of, okay, you know what, check in, hey, my labs came in, and now I can get a ping from my provider saying, it's exactly what we thought, it's okay. Or, and not that that's necessarily an opportunity for branded messaging, but it helps create this positive reception to those connection points. And with that positive association, now you've opened the door for effective brand messaging where appropriate, and as long as it's supporting those brand strategic imperatives.
Yeah, the reinforcing foundation right there. It almost goes to like brand trust at that moment. Yeah, that's great. Edith, any thoughts?
I love the stat on improved medication adherence. Goes to the reminders I talked about earlier, right? That is one of the goals of pharma marketing, right? Find the right patients, get them on the right therapy, and then make sure they stay on it. So the fact that we can see that virtual care is driving such an impact, 54% is, of physicians, I believe that stat was, right?
Yep.
54% of physicians are citing improved medication adherence. That has to be huge for your brand marketers.
Absolutely, especially for those brands where we see that severe drop-off.
Yeah.
It's really nice to know that, hey, this is a great place for us to be in. And it works because it's easy for them.
Yeah.
It's easy for them to send those reminder messages. Sometimes it's automatic. When it can be easy and when it can feel organic, then now you've created a stable environment where we're fostering that trust, and you're seeing better efficacy.
Yeah, I agree with you. I think the improved medication adherence is such an important stat here. I think the takeaway for pharma in terms of ROI that conversation is around, and it goes back to a similar conversation, and sort of challenges us on this idea of silos, because a lot of this is parallel between patient and HCP, and this opportunity to look at the different levers that take place for each party towards that common goal. 82% reduced no-shows, that's crazy. Like that idea, both for a physician in terms of their practice landscape, the stress on their office, the reality of those pieces, and they go together. Like it's 82% reduced no-shows, 81% improved follow-up completion. But we talk about those places where you're trying to drive from this part of the funnel to this part of the funnel to all the way to adherence. Virtual care presenting an opportunity to tighten the drop off there is really promising, especially with a number like over 80%.
I love the way you brought that back to the business economics, because we saw that in the report of running a practice. A physician is a small business owner, or they're part of a large business. And they have financial goals as well as, of course, keeping patients healthy. So the fact that they're helped in making their practice run more smoothly. They have more compliant patients. They have more satisfied patients. That's huge. Satisfied patients are more engaged patients. That's why they're following up. That's why they're filling their prescriptions, and that's why they're making the physician's life easier.
Absolutely. It's interesting that you bring up satisfaction, because I think we're hearing increasingly from pharma that HCP satisfaction or customer experience is a touch point. Whether how you're measuring that as a KPI maybe is a separate conversation, but you still have marketers that are passionate about the HCP experience, and partnering with them in this landscape that they're already utilizing as a way to further drive positive experience feels like low-hanging fruit.
All right. There's a finding in this report that I want to spend like a minute or two on. And it's because I think it explains why virtual care conversations sometimes may stall inside pharma organizations. The report calls it, we call it three vocabularies. Patients describe virtual care outcomes as safety, satisfaction, we talk about comfort. Providers describe it as adherence, follow-up, completion, and chronic care management. Marketers describe them as script lift, new patient starts, and engagement. Same journey, three different languages, completely different languages. And if pharma is only speaking one of those to three outcomes, is it missing something? Or should all the outcomes be considered? So for Edith and Taylor, this feels like a strategic problem as much as a vocabulary one. What should a pharma media executive consider when it comes to differing outcomes?
I can jump right in, because when we fielded this report, our goal was to understand not just one perspective, right? We wanted to understand the patient perspective, the physician perspective, and the marketer's perspective. And we wanted to see where the gaps were. I think what we just mentioned was one of these gaps. So if we have a patient whose primary goal is satisfaction and engagement, more engagement with their HCP, and we have an HCP who's come along that journey, and now they're using virtual care first because patients demanded it, but now because they see the business of that. And we have marketers then who are measuring on scripts. They do tie together, because a better engaged patient and a more proactive physician will ultimately result in scripts. But I think the big question is how we measure that. Do we measure this only on new scripts written? Because a new patient may not need a new script always, right? They may need a different pathway. So I think the measurement is a big question, and it's, do we look more closely at engagement, or do we look always at scripts, which I think that marketers tend to do?
Yes, and we kind of finished our last conversation around budget, and I'm happy to introduce that as a function of the conversation earlier. But I think to your question, Andrew, it's okay that we use different terminology, because I'm going to compare this to health literacy a bit, where everybody's speaking a different language. Even if we're all saying the same thing, it's appropriate to use different words or different terminology, because it wouldn't be appropriate to say to a patient, "Did you get on brand?" That wouldn't.
Wait a minute, what are you saying?
That probably wouldn't land as well. So I think it's okay that we can exist in multiple frameworks and with multiple terms to say the same thing. However, I think to your point, it is important for us to early and often address what is the key role of this as a channel, right? What are we trying to achieve here? And based on that, how do we measure success? So that is something that we do factor in. And yes, of course, we're going to look at conversion to brand, assuming that is appropriate for that brand. There are other brands where the primary action could be getting screened. And that's the thing that we need folks to do. We need them to take action on that. And so with an unbranded campaign that's driving folks to screen, no, it wouldn't make sense to track somebody getting on brand. It is, what does that engagement look like? Did a conversation come from that? Did they get a referral to screen? And so, there are all of these touch points along that care journey. And I won't say just for patients, but also for providers, that we can measure. But the question we should always first ask is, what are we trying to do here? What's our goal? And then from that, determine how do we measure success? What's going to be that best fit?
There was a great stat in your last conversation that came out. Christine, I think you brought it up, and it was 65% of patients would either skip care altogether or delay care. And when you spoke just now about getting a patient screened, getting a patient to have a specialist visit, virtual care is such an important part of that, right?
Yes.
And I think that's where we can really make some impact.
Taylor, I love that you brought up that piece of like you need to understand what the thing is that you're trying to, what the goal is.
We have to confront unconscious bias head on,
Yeah.
right? And by that I mean providers are not omniscient. They know what you've told them.
Yep.
And you know what we've told you to tell them. So sometimes there are gaps in that where there's a particular buzzword that until you say that, it's not going to go off for a provider. That key piece, oh wait, maybe this is this and not that.
Yeah.
Or how did you get here? Or maybe we just managed this way.
Yeah.
I think that there's speed to care is a really interesting one because we can't talk about that without talking about systemic failure, and we don't have the time.
We don't. It's a whole other podcast, right?
Yes.
No. Yeah.
But
Wait a
it is
minute.
it is a good call out. I think
Yeah.
it is a good call out, and I think that is something that inherently is part of what we do.
Right.
Whether we start to use that as a true measure of success,
Right.
it could be an auxiliary stat that we tend to look at.
Yeah.
But I think we try to do that by being cognizant in the patient education materials we put out and making sure that we're factoring in literacy. We try to do that with the provider side to say, hey, get ready. Here's the questions you can expect to field.
Yeah.
And also here's what you should know about these treatments. I think we could be doing a much better job communicating to those two subsets. But I think as far as helping to create those better outcomes, there are a plethora of reasons that we can't control for why that breakdown may be occurring. And it could truly just be a lapse in conversation or not using that buzzword that's going to, that symptom, something that's going to set off, oh wait, this might be a better fit for
This
you.
might be the thing. Yeah. That's a very valid point. I agree with you. Yeah. It's probably a tangent, but I do think it's a good
I don't
point.
mind the tangent. It's a good tangent. Cut or not, we know it. We've said it. All right, well, let's continue down the attribution path because here's the measurement case, and it's a strong one. 78% of pharma marketers say virtual care delivers better ROI than traditional digital health advertising. Almost half say it offers better attribution than other digital channels. And more on how virtual care accelerates treatment initiation, and obviously back to the speed situation, right? But if the ROI is there and the attribution is there, what's keeping the investment from moving faster? Edith, your thoughts?
I think a couple of things. I don't think there were a lot of patient portal opportunities from a product standpoint before now.
That makes
I
sense.
think before now there wasn't scale within the EHR. So from a very baseline product perspective, I think until now we didn't have the scale for marketers to really take it seriously. I think one of the things that's super important when we think about the EHR environment is, I know that you love to talk about health literacy, and I absolutely share that passion with you. And I hope we have an AI conversation at some point because we've lots of ideas on how AI could help
It's
with
coming.
with health literacy. But I think within the EHR, one of the things that's overlooked is the value of the data, right? So if you think about, we've talked about recency, we've talked about precision, we've talked about the data that can be used now is used more like a tactic, right? The EHR should never be a banner ad tactic. That environment is so important. That interaction is so important that it should start to fuel a much longer chain of interaction with both the patient and the HCP. And I think that maybe not all marketers understand that yet, that you're seeing a physician and they're writing a script that you won't see in claims data for another 3 months. And you, in that moment, can help that patient get on a PSP program, deliver a coupon, deliver more relevant health education. So I think that it's a platform and it's a opportunity that's not fully understood by all marketers. Taylor aside, of course, because she's at the forefront of this.
Very kind. I think you touched on a couple of different things there. I think, yes, the opportunities are now ever present, and I do see a shift in the conversation internally. I'll give away some secrets. It does come up a lot more often now when we're building plans and we're thinking about where should we be and why should we be there and how should we be there. And so we're always thrilled to hear about new capabilities and new offerings, and that's, fantastic to watch that evolve. And that's been an amazing thing to see change even just this last year.
Yeah.
I think the other piece, when we talk about more altruistic things, right? Like meeting folks where they are and delivering important messaging, those can absolutely be jobs to be done for media for particular brands. It just has to be agreed upon at the onset, right? That it is absolutely appropriate for a company to invest in that data to better understand who are we missing? Who are we leaving out of the conversation? How do we effectively connect with those folks? But I think when we get into ROI, and I think this may be where you were going with that, it's such a fluffy metric. It's math. You can inflate it, you can deflate it, you can make it look any way you want, right?
Not true.
What are you saying?
It's ridiculous.
And that's where I think we get into trouble sometimes when we hang our hat on ROI versus conversion to brand. There's a distinct difference there where you're talking about the number of folks you actually successfully helped link to, connect to, adhere to your brand versus ROI. And ROI is funny because, when we're talking about there being better ROI on digital programs versus more traditional programs, of course that's going to be the case. Yeah. I think the more interesting piece of that is what is the conversion to brand with one-to-one zero waste messaging versus being in an office. I think both have a value. I think both serve a place. As we talk about, this isn't a silo, this isn't a static touch point. This is building over time. And that's the goal. That's why we plan across multiple channels. That's why we build these entire ecosystems to work off of one another really and have that continuity of messaging to eventually kind of hit that moment where the lights go off to pull through that messaging and shorten that time to brand or shorten that time to better outcomes.
Yeah.
All right. Well, one of the findings that I just literally may have stopped me in my tracks, and I know, Edith, I had kind of the same aha moment when we saw it, that 53% of providers find pharma presence in virtual care acceptable or helpful. More than half, majority. Now hold that number next to this one. 57% of those same providers rarely or never encounter pharma brand messaging in these environments. The permission is there. The presence, it may not be. And that's not a regulatory barrier or a channel access problem. To me and to us, it's kind of an execution gap. So I want to open this up to all of us. Like, what's behind that gap? And how should marketers read it? And is there a why behind it?
I think we'd be remiss if we didn't factor in health systems. For the last 10 years, at least, there has been a shift away from individual providers owning individual offices to being folded under larger health systems.
Significant
and
shift.
That's a beautiful thing because with that comes additional access, additional resources. All of these virtual care components now become available to a smaller provider or a smaller provider office because they're folded under this umbrella. However, that means you have a new boss and you have a new set of accountability and a new set of rules by which to play. So it's wonderful to hear that providers are eager and accepting and willing to have this messaging in those sacred spaces. But the hang up and the red tape and the red line we hear from folks such as yourself sometimes is that we don't have access, we don't have inroads. That particular health system does not allow branded materials to be present in that moment. And so you kind of have this juxtaposition of HCPs being quite literally the only profession that you can market to directly being blocked by their own health systems because there's a preference to avoid bias or to seem, to demonstrate some sort of favoritism.
Thankfully, we're seeing that change over the last year because I completely agree with you over the last 10 years, the consolidation of small practices. But we have 350 healthcare major HCOs within our network currently. And we're seeing that grow as you deliver the benefits, right? Once we can show that we're respectful of the environment, that the materials that we deliver for HCPs are clinical and relevant and precise and only delivered when that physician needs those particular materials. So hopefully we'll continue to see more and more, and that number will increase in terms of the number that are available and also happy with it. But you're right, we have to be really good stewards.
Part of what this report is meant to do is, Edith, to your point, sort of provide industry level insights on the patient perspective, the provider perspective, and then layering in sort of the pharma status quo. But this is a moment in time where rapid change may be coming too. So if 53% of providers are already saying, hey, a pharma presence is acceptable or maybe even helpful to me, it's that exposure is coming. because
that's
we
the
needed
patient
the
too,
proof
right?
point.
I think in your last
Yeah.
conversation,
Oh, yeah, the
we
patient
talked
desire
about
is
the
higher.
patient
sure.
wanting
They're at
patient
like
support
73%.
programs.
Yeah, they're
Yeah.
they're kind of meeting each other in separate
Yeah.
lanes, but they're going for the same goal here.
Right?
Yes. And I'd harken back to a point that you made actually in the last question to build a bridge a bit, where you were talking about data and the value, and maybe it's not just conversion to brand, but I think one of the other pieces here is target lists.
Yeah.
We're all bound by target lists, or for the most part, we're bound by target lists, unless we're doing direct to patient messaging. So, given that there are specific providers and provider behaviors that we are budgeting against because we do need that proof of performance, whether measured by ROI or some other metric, I think it's important to note too that where there could be an opportunity and a way to move that metric a bit is using this data to inform those target lists and sharing that back to say, hey, but don't forget about these folks because they do want your information, they do want your content, and by the way, here's a great way to deliver it.
Yeah.
So I think we are at the precipice of this conversation really changing some great things, but I think another way in which we can do that outside of ScriptLift is really starting at the onset and informing target lists and where should we be present and where will we be best received.
I think that's such a great point because when you think about it, a target list is created from claims data. Decile stock, high rider, right geography, I have a sales rep in that territory. That's how target lists are created. But you don't know what's happening in the EHR, and there could be a physician who's writing 10 scripts a month and none of them are getting filled because there's a prior auth problem, or because the patient is looking for a coupon, or they want to enroll in a PSP program. So I love that concept of take a closer look at what's happening in the EHR to really understand the physicians that you should be targeting, but maybe the way that they become a target is by better informing patients and giving patients the resources they need within that environment.
Oh my God, you just teed up the next question so beautifully. So, when you think about the investment, and we talked about this on the patient side, now we're going to talk about it on the HCP side, 81% of marketers increased virtual care spend in the last year with PSP pairing, gaining traction at 57%. So where and what are the executions that are landing well?
I think where we're seeing a lot of inroads for HCP messaging is within those EHR and EHR-like placements, right? Where you're in workflow, where there's the context. And that contextual piece is something we know from providers directly that is so valuable, right? Being there right in that moment, giving them the information they need to effectively diagnose or consider that. I think that has to be echoed in the actual office environment. Because then when they're seeing folks in person, you need that visual prompt to say, hey, don't forget about brand. Hey, don't forget to ask this patient these things. And beyond that, the unfortunate downside to some of the virtual care is that it's such a limited scope, you don't have reach to those advanced practice providers or auxiliary providers that are also in the office. So we also need to find ways to be present for those folks so that we are casting a wide net because again, the care journey isn't just on one particular provider, it's almost everybody that they interact with. And we know NPs and PAs and nurses and the like spend more time with patients and have more discussion with patients outside of potentially the virtual care setting where you are connecting direct with your HCP. I think, it's really, I think it's important for us to show up in both the digital environments and in the workflows, both physically and virtually.
Gosh, I want to come back to the data because data is my thing, health literacy and data. So with data, right, because I truly believe that the HCP journey should be founded on this EHR data, right? So you have the data, you should be interacting with the HCP within that clinical workflow, but following up in their inbox, you should be, that's the way that you can link to all the NPs and PAs within that practice, right? So if we have the email addresses of everybody in the practice, the physician got this message, the physician diagnosed a patient, now you can give much more targeted communication to the entire practice. I think we'll do some product development together.
I was going to say there's not enough data sharing yet, but absolutely, and that's what I mean. Before about data informing,
Yeah.
I think absolutely.
Yeah.
That's such a key piece and an excellent call out.
You heard it here first, folks. Heard it here first. Christine.
Well, it's a good reminder that the ecosystem is not virtually exclusive, right? That it spreads across both what's happening in those patient encounters in the office and physically, as well as what spans into virtually. Interestingly, I use telehealth for one of my physicians, and the nurse starts the call. So in my case, I spend 5 minutes with a nurse and she does all of the same sort of in-office prep that you'd get,
Interesting.
checks to see if I have questions about the prescription, and then the doctor comes on. So it'll be interesting to see how even that dynamic continues to expand as virtual care becomes more ubiquitous.
Christine, back to you on a quick point. So,
Yeah.
Since you were kind of our lead when it came to the HCP engagement with the partnership you were able to orchestrate with us for Sermo,
Yeah.
and with Sermo, is there a gap between the channels marketers say that they're using and the channels providers say that they're actually encountering?
I don't think that I would say it's a gap necessarily. I think that, and again, I apologize for repeating myself, I do think it's because we're mid-evolution.
Yeah,
And
we keep going back to that.
You sparked an idea about exclusivity being a key piece to this, and that's something we haven't yet talked about.
We haven't.
And that we don't want to crowd the marketplace, so there becomes this limitation and this high value reality where you are the only brand for a
Right.
particular indication, and potentially for even that HCP for that channel.
Right, for that office.
So that also will limit, right? Because you can't have everything available all the time, and every brand's not in the same place. So I think that may sway or impact results a bit too.
Yeah, I think
Or
that's
perception.
True. Yeah. And look, you that's why you introduced Taylor the way that you did. I think that insight in terms of how this actually works, right? What does this look like in practice when you live in the seat that you're sitting in? I think that's an important consideration.
Absolutely. There are times where we would like to play in a particular space, but we're just limited.
Right.
Whether inventory or exclusivity.
Yep, absolutely.
And that's why we're here.
Yeah.
The data says one thing, but what's the truth around it, right? And so the numbers are the numbers, and the numbers never lie.
Right.
But in this case, it's like, how do we activate against it? How are you activating against it? How are brands to outcomes? So 100% happy that we're having this conversation. This is why we did it.
Yeah.
Right. All right, we're heading into our few final minutes here, and I just want to close the same way we did with part one, with that one actionable thing. So based on the HCP findings in this report and this part, what is the one thing you'd want the room to do differently with a virtual care strategy in 2026? And Edith, I'm throwing it to you.
Guess what my answer is going to start with? Data.
There you go.
I really think, you can tell because I brought it up 3 times already, right? I think utilizing the data within that environment, that's so important to drive strategies that, the prior auth strategy, the PSP strategy, the journey strategy, the alert the sales force when in HCP, because we all know the target list has been created from claims data. Alerts go to the sales force now when a physician writes a script, right? But it's 3 months old, right? 2 to 3 months old. So using that data beyond just delivering a banner ad, beyond just putting a message within that environment, which is enormously valuable, but it doesn't truly unlock, in my opinion, the value of the EHR environment and the EHR data.
I would say yes, and keep innovating. Keep finding ways for us to do that. And it doesn't have to be innovation of a tactic. It could be innovation of data share, right?
Yep.
Keep thinking of ways that we can leverage what you all are learning, because you know more than most anybody as you're collecting data, as you're living in this every single day. So that may be a value to bring outside of another place to place an ad.
Taylor, I think you've had some really good catches in here about thinking about what your goal is. So think carefully about what the goal is and know that this, because it's an entire ecosystem, because it's a landscape with lots of different opportunities, it's not going to be one size fits all. So not only, I think, to your point, do you look at a channel and evaluate what goal it's meeting, but you reverse that and think about the goals and then what channels will help activate and improve what the outcomes that you're looking for. And then I think, Edith, to your point, it is about the data and thinking carefully. I really loved how you kept bringing us back to the HCP's experience across what it looks like in their health system versus their small business project. What is their experience like in the EHR? Yeah. So I think it's important to think about the customer experience in this moment. Map that journey, map the customer journey, know who they are and what it is that you want them to do. And because it's something I'm really passionate about, think about one way you can break down a silo. So I think you had a valid challenge to that idea in our last conversation that, hey, sometimes the silos exist for lots of practical reasons, but think about one way that maybe you can reach across HCP into your patient counterpart, or that you can help have that integration be more specific and more experiential for the patient and the physician when they get in that same space.
I love that. The HCP is on a journey, just like the patient is on a journey. What are the relevant intersection points that you can make the HCP's job easier, and you can inform and educate the patient better with the appropriate health education materials, right? You know, again, back to the health literacy. I can't wait till our next conversation around AI and what AI could do to help with health literacy. So Taylor, we'll invite you back.
Yeah.
Christine, we'll invite you back. You will be part of the report. You will be part of forming those questions for us.
Yeah, you'll be seeing some familiar faces as we continue down this path. Thank you, all three of you, for this incredible conversation. This is exactly the kind of grounded and specific thinking that this data really needed. So I really appreciate Edith, of course, Taylor, of course, Christine, of course. We did it. These 2 webinars, we got them done. Patients, providers, and marketers trying to connect. And the through line across all of them is the same, that virtual engagement drives real outcomes. The clinical infrastructure is there, the patient trust is there, provider openness is there. The ROI case is there. Are you there? Virtual Care in America, the Populous Report. Thank you again for joining the conversation. If you missed part 1 of this series, The Patient Perspective, you can find it exclusively on the Populous website, and that's populoushealthtech.com. And as for the report itself, and as you've heard, it's filled with data, all surrounding the power of virtual care. It's also available on the website, so make sure you download that too. And remember, the platform may be virtual, but the outcomes, they are very real. Thanks again.